There are great programs that deal with disease once it manifests itself, but there aren't any other programs that provide preventive and acute medical care for the poor in our community that are uninsured.
St. Vincent's Mobile Health Outreach Ministry is basically a doctor's office on wheels. We take primary care services to where the patients are. We offer this at no cost to the patient. We do blood pressures, we do screenings. We're staffed with a physician or a nurse practitioner. We have nurses, medical assistants, whatever is needed for that particular clinic day.
We refer all of our patients on to the specialists that they need to handle whatever the problem is.
We're serving a lot of people to far reaches. We have an urban outreach ministry, which is the one that cares for people around our immediate communities, and then a pediatric outreach program as well that serves the elementary schools in the area, and especially in many of the at-risk areas in our community.
Our rural program is working with farm workers, fernery workers, and then agricultural workers.
I had a thyroid with some tumors in it. Then they found Dr. Loper, and Dr. Loper said that I needed to have a surgery. That's all I wanted. I felt blessed. I got home. I told my mom. I was excited. I was like, St. Vincent's finally did it. They're going to give me the surgery.
Well, they come here because there's no other place for them to get health care. In many cases, some of them are undocumented, and they just can't get health care anywhere else. As far as how it impacts the community, by treating these folks, we're keeping them productive, working back on the job, I think that has an impact economically.
Our mission is to take care of the poor and the uninsured. St. Vincent's has been doing this since 1916. And I feel like St. Vincent's Mobile Health Outreach Ministry is actually the mission of St. Vincent's in action.
I would probably be dead right now if it wasn't for St. Vincent's Mobile Unit. Something happened in my life to where I needed self-control. I kept myself sedated, you know, and alcohol, where I think I just didn't care maybe. My blood sugar was totally out of control. They took me off the metformin and got me on insulin. It's been a long process. If I kept living the way I was living and not caring, and I don't stay on top of my meds, there's only one road to lead to, you know.
Last year, we offered 28,000 services. Those include not only the primary care visits, but the follow-up visits.
I'm glad that St. Vincent's is here so they can help out. I'm glad that they do have this kind of help here for the people that really need it.
They care about me, they call about me, they know my personal life. They worry if I have food, if I don't have food. They've been there through the thick and thin of everything.
Moms and dads, brothers and sisters, little children, the adult workers in ferneries and in migrant fields, the inner city poor. They don't know where to turn, and when they come to St. Vincent's, to our Mobile Health Outreach Ministry, we look at them holistically. They will say, I thought nobody cared for me, but you proved that I was wrong.